Welcome to Diagnostic Imaging. I'm Whitney Palmer, Senior Editor. We are joined today by Dr. Kevin Sheth, Professor of Neurology and Neurosurgery and the Director of the Neuroscience ICU at Yale School of Medicine. Recently, his department began using Hyperfine, the bedside MRI system, with COVID-19 patients who were at risk for vascular complications from the viral infection. He is with us now to talk about his department's experience. Thank you so much, Dr. Sheth, for taking the time to talk with us. All right. Well, then, in the context of COVID 19, what role can bedside MRI play, and why is it so important when it comes to treating these patients?
Yeah, the first thing I would say is that this is very early, right? The use of this kind of a system in a pandemic. So be very important not to accidentally overreach or I think there'll be a huge temptation on the part of a lot of different people to get very excited. There is a lot of reasonable excitement, but to match that with not being sort of too superlative about it. I do think what the pandemic highlights and what is that in a way that normally we might be thinking about in rural settings or third world settings, like we talked about previously, is that there's clear opportunity to have a portable MRI system, right, where you might not be able to do intracranial imaging. In the setting of COVID-19, you have, first of all, just widespread pandemic, and then you have patients that are in ICUs that are oftentimes, very sick and unstable to move for diagnostic imaging, right? So patients that are sedated, oftentimes, you're not getting neurological exams of any time for days. They're in medical comas, and you have no way to just to look clinically or radiographically as to what's going on inside the brain. And so, in that context, while it varies probably from hospital to hospital, um, at some places you can still get a CT scan or an MRI scan, but at other places you can't. If you can, it's usually a big production, very difficult, not necessarily safe for patients to move. And even at all hospitals, there's certainly a subset of these patients in the intensive care unit that are just too unstable to move. So that premise shows you that there is a need, there is a gap that something could fill if something could provide sort of meaningful intracranial imaging. And then if we look at a device like the portable MRI, it's a natural place to jump in and fill in that gap because you bring, right, the whole concept is that you bring the portable device to the patient as opposed to moving a sick patient to the device, and you can do so in the routine clinical setting, right, in the ICU room. So that's the opportunity. We started imaging some patients with COVID-19 that are in our intensive care units, just like this. And, in that sense, I think it's sort of, in terms of just process, it's very, very helpful.
Excellent. Well, given that you have used this with patients, and obviously, working within the guidelines of HIPAA and information that you're able to discuss, what has your experience been? What are you seeing when you bring this system to the patient and have that chance to kind of see intracranially?
Well, I think at this level, we don't. I think no one should or could make too many statements about what they're seeing because that's a small number of cases, still so far, whether it's here or anywhere else. And and what we can do, though, I think, with some reassurance, is rule out maybe things that might be relatively obvious to see on a CAT scan or a conventional MR, like a brain hemorrhage or a large stroke, or if there was some kind of very diffuse swelling or hydrocephalus or things like that. We haven't seen, we've imaged a couple of patients that have had known pathology from conventional scans, previously that we could recapitulate and see on the portable device. So that was reassuring. And it also told us that those pathologies had not changed over time. So that's helpful information. I think in other situations, you might see quote unquote a normal scan, and even knowing that is helpful to an extent.
Okay. So then, alongside the clinical impact, and you touched on this just a moment ago, but COVID 19 has presented a litany of other concerns, when it comes to viral transmission and safety
Yeah.
and other dangers. So, what is it about having a bedside MRI that may help you navigate those issues?
Well, I think I think it both helps and it also raises new issues. So it helps in the sense that moving these patients around the hospital on multiple floors, going to areas where a lot more patients might be going that are not affected with COVID-19. MRI suites, CT scanning suites, taking them on and off the table, having MR technologists. I mean, there's a lot more exposure to both equipment and people if you have to move people. When you can bring a device into the room, at least you can limit some of that exposure, right? So that's, I would say, helpful. It does mean, analogous to other devices that you would take into a room, like a portable chest x-ray machine or an ultrasound device or any other device, is that now when you take something in and out of a room, it is something extra, right, that you're taking in and out of a room. So you have to be mindful about how to clean that, and not, you don't want the virus jumping from the patient to the portable device only for you to move the portable device, to another room. What we've done is we've had a dedicated device that's only for COVID patients. So that way, at least if you're going from room to room, you know, both patients have COVID anyway, right? So you're not sort of increasing the transmission. We've had multiple devices at Yale, and so we have a dedicated COVID device and then a dedicated sort of non-COVID device.
Okay. All right. Well, then, like you said, we're very early in using bedside MRI in general, and then particularly with COVID-19 patients. But how would you describe the impact that it's had so far on your ability to provide care? A couple of takeaway messages, perhaps.
Well, I would say the biggest takeaway message is number one, that being able to perform meaningful intracranial imaging during a pandemic and in general for critically ill patients in a way that COVID-19 highlights um, has today been a huge monitoring gap. And there's a need. There's a huge need there. That's what the pandemic highlights, especially from a neurological perspective. The second thing I think is that a solution like the portable MRI and our ability to scan patients successfully shows that this kind of method is feasible and is certainly an important and viable approach. And the next step is just pushing the conversation that we're having about how do we get now, in that context, enough meaningful experience that we can show that it can also drive decision making and monitoring. But in terms of process and feasibility, I think that our experience shows that we can.
Wonderful. All right. Well, thank you so much for taking the time. I do appreciate it.
My pleasure. Thanks so much.
Thanks.